Now, the difference between heart failure and sudden cardiac death, let me try and explain some terms. Now, heart failure means the heart muscle is weak, all right? It is not pumping at maximum efficiency. So when a normal heart pumps out blood, it's supposed to pump out maybe 60% of the volume of blood in the heart and pumps it out to the rest of the body. So in normal, what we call ejection fraction is about 60%. Now, when your heart starts to fail, what it means is it's not that it has stopped, but it is weak. And it's now pumping out maybe 30% or 20%. So it's like a water pump that's designed to pump up to the 4th floor. But it gets damaged. It's still pumping water, but it's only getting up to the 1st floor or just to the ground floor. So it's working, but it's working very inefficiently. Or like a 6-cylinder car that the engine has knocked and it's working only on 2 cylinders. The car is moving, but it will get you to where you're going in a much longer period of time than a regular engine. So that's what heart failure is. Now, sudden cardiac death, where people suddenly just drop dead, no symptoms, is what we call a cardiac arrest, which means the heart just stops. The electricity of the heart just stops and everything stops working. So that's the difference between a cardiac arrest and heart failure. So cardiac arrest can be caused by other things than a heart attack. A heart attack now is when there is a blocked blood vessel to the heart. So the heart is supplied by 3 major arteries, and the blood is supplied through those arteries, and through that blood supply there's oxygen supplied to the heart. Now, if there's interruption of that blood flow, usually by a blood clot, cholesterol buildup, that part of the heart muscle that is supplied by that blood vessel gets damaged, and that's what a heart attack is. So it's damage to the heart muscle. Now, it does not always lead to death. It leads to complications, which could include death. So the severity of the heart attack depends on where the blocked vessel was. So sudden cardiac death, common cause heart attack. Another common cause, pulmonary embolism. Another common cause is an enlarged heart for whatever reason, hypertension, something called hypertrophic cardiomyopathy, which you are born with, where the heart muscle is unusually enlarged. It's not usually picked up unless an echocardiogram is done. I'm sure you've heard of soccer players, athletes dropping dead suddenly while they're exercising or during a match, things like that. That could also play a role.